Welcome back, everyone. Today, we're going to put on our detective hats and solve a little clinical puzzle together. It's all about spotting the one thing that just doesn't quite fit in a list of classic symptoms. You ready? Let's dive in.
Okay, so let's not waste a second. Let's get right to the heart of the mystery we're trying to solve today. So here it is. Common clinical signs of hemothorax include all of the following except A. Mediastinal shift, B. Labored tachypnea, C. Pallor and tachycardia, or D. Collapsed jugular veins. Now think about it. 3 of these are textbook classic signs, but one is the odd one out. Go ahead, lock in your answer, and we'll circle back to see if you nailed it by the end. To solve this properly, we gotta start with the fundamentals. Before we can even talk about the signs, we have to be absolutely crystal clear on what a hemothorax actually is.
Okay, so it's actually pretty straightforward. A hemothorax is simply when blood starts to pool in the pleural space. Just think of that space as the super thin gap that exists between the lungs and the chest wall. And in this case, it's filling up with blood.
And you might be asking, well, where is all this blood coming from? It's an internal bleed, right? So it's usually coming directly from the lung tissue itself, that's what we call the lung parenchyma, or from other blood vessels inside the chest that have been damaged. All right, so now we get what's happening on the inside. So let's talk about the clues we can see on the outside. This is all about reading the signs the body is giving us.
And really, you can break these signs down into 2 big categories. First, you're going to see signs of shock, which makes total sense because the body is losing a lot of blood. And second, you're going to see signs of respiratory compromise because all that blood is literally putting pressure on the lungs, making it hard to breathe. So let's break that down even more. For respiratory compromise, you've got labored tachypnea. That's just a way of saying someone is breathing really fast and working hard to do it. Then you get that whole cascade of shock signs. They'll look pale and maybe sweaty, which is pallor and diaphoresis. Their heart will be racing, that's tachycardia. Their blood pressure will be dropping, hypotension. And you might even see collapsed jugular veins, simply because there's less blood volume in the system to fill them up. These are all the classic things you'd expect to see.
Okay, so we've got our list of usual suspects. We know what to look for. But remember our question? We're on the hunt for the exception. So let's figure out which one of these signs just doesn't fit the typical pattern you'd see out in the field. And this is where it all clicks into place. On one side, you have all those common signs. The shock, the breathing trouble, stuff you can see right away just by looking at the patient. But on the other side, you have the exception, a contralateral mediastinal shift. Now, this is not only rare, but here's the real kicker. You can't reliably diagnose it just by looking. You absolutely need a chest x-ray to see it. It's just not a clinical observation in the same way. All right, all the evidence is in. We've defined the condition, we've gone through all the common clues, and we have identified our rare outlier. It is officially time to solve our initial question. And the final answer is A, mediastinal shift. Did you get it right? It's the exception because while it can happen, especially in really severe cases, it's just not considered a common clinical sign. The other options, the breathing problems, the paleness, the rapid heart rate, those are the direct, observable results of blood loss and lung compression that you'll see much more readily. So why does all this matter? The big takeaway is this. In a real-world emergency situation, you've got to focus on what you can see and assess immediately. You're looking for those telltale signs of shock and difficulty breathing. That's your primary actionable information right then and there. So we've solved the puzzle, but, that really just leads to the next big question. Recognizing the signs is obviously the critical first step. But what do you do with that information? What actually comes next in taking care of the patient? That's a whole other chapter. Thanks for joining me on this one.